Hello, everybody. It's Dr. Tamara here. On a Wednesday night, if you are watching, you will see that this is a pre-recorded. And that's because I am out right now talking to a bunch of clinicians around a topic that I am pretty passionate about, and that is the impact of weight on fertility. And I really wanted to have a heartfelt and I guess vulnerable conversation with you guys about this, because it is a big thing when it comes to talking to women, particularly women who have come to see me because they're not able to fall pregnant, whether it's they're having miscarriages or whether they are just not falling pregnant. One of the things that can come in conversation is weight. And I'm not just talking about overweight or obese. I'm also talking about underweight as well. And the very first thing off the bat that I want to say is that society has this thing over us and weight. And it comes down to social media, it comes down to advertising, but we often feel really shameful. We often feel really emotional when we are talking about our weight. But the reality is, weight doesn't define us. Weight is a thing that we experience, much like we might experience, I don't know, type 2 diabetes or asthma. It's something that can have a pathological effect on the ability for us to either get pregnant or stay pregnant. And because of that, it is something that has to be addressed, just like we have to address all those other potential things that can impact on our ability to conceive. But we as women particularly, sometimes guys too, but we as women will always feel really personally attacked when we're talking about weight. So from one woman to another, from someone who understands the emotional aspects of overweight and underweight, normal weight, and all those things to do with weight and weight loss and weight management and all of that, I understand. But it's really important for us to also understand the implications that weight has on our ability to fall pregnant and stay pregnant, and also how it impacts on our experience of pregnancy, but also how it impacts on the health and well-being of our future children. And so I just want to talk really, really briefly to 5 things. You know me and my 5 fingers on my hand. I want to talk to 5 things that I know to be true about weight and fertility. So the first thing is, we know that carrying too much body fat, so probably overweight or obese, not just a few kilos, is going to impact on the egg and the quality of that egg. So the egg grows up in this intrafollicular environment, and if we're carrying too much body fat, there will be increased inflammatory markers, there will be increased lipids, there will be increased toxins and sugars that exist in the fluid that surrounds the egg. And that affects the programming of that egg. And so we know that women who are overweight and are having issues with fertility will find it more difficult to conceive with their eggs that they will have difficulty in falling pregnant with eggs from a lean donor, for example. So there is some effect of obesity on the development of the egg. We also know that it affects the endometrium, and we think that there is some genetic programming that happens in that. We know women who are overweight will find it difficult for an embryo to implant in the endometrium. It also sets up that metabolic environment in which an embryo is going to implant into. And so there is the potential for being overweight to impact on the genetic programming of that embryo, sort of that whole epigenetic environment. And so that then brings me to the impact on the well-being of the future child. Now, before I address that, I just want to talk about the impact of weight in pregnancy. So you would probably know that women who are overweight, and this is not all of them, but we know that a risk factor for developing gestational diabetes and also preeclampsia, which in themselves then increases the risks of cesarean deliveries, of preterm birth, birth injuries, birth traumas. A risk factor for those things is being overweight or obese. And so your pregnancy experience will be impacted. But I want to talk finally to the impact on the well-being of the child, the future child. So we know that there is that overweight and obesity is a risk factor for a child developing congenital anomalies, so anatomical abnormalities. We know that. We know that there is an increased risk of neonatal injury during the birth process itself. We also know, as I've alluded to, that there is an increased risk of preterm birth, so being born early. And by being born early, there are increased chances of developmental issues, learning difficulties, and so on, amongst a myriad of other things. But there's also the metabolic programming. So we know that children who have overweight or obese parents, mother or father, will have a much higher chance of being overweight or obese as an adult, but will also have a much higher chance of developing diseases associated with overweight or obesity, such as type 2 diabetes. And this is regardless of whether they have overweight or obesity as an adult. So there's this metabolic programming that we know happens. And so when I put all of that in context, and I'm talking very medically about this, when we put all of this in context, you can see that obesity itself, it's not a label. It's a pathology. It's an impact on your medical health and well-being and that of your future generations that we need to manage. And I feel really strongly that I am responsible for helping a couple to conceive, and part of that is helping them with the issue of overweight and obesity, just as I would if they had issues associated with their thyroid function or their prolactin levels, if they had issues with their blood pressure, which will affect them in pregnancy. I would want to be optimizing that before they fell pregnant as well. So it's my responsibility to help that. So when people ask me, and people have asked me many times, do you treat people who are overweight or obese? 100% I treat people who have obesity. And the first part of that treatment is optimizing their weight. And there are lots of different techniques, and there are lots of different professionals that I lean into to help me with that process. But that is where the treatment starts, because I want to get the best out of your treatment for you. I don't want you to do 1,000 treatment cycles. I want you to do it once, and I want you to do it well. And so that's why, yes, 100%, I will treat a couple where one or both of them has a problem with overweight or obesity. And the same goes for a couple where the woman, predominantly the woman, is underweight. We know that underweight has a significant impact on ovulation. It will impact on the signaling between the follicle and the egg. It will have an impact on the development of the endometrium. and therefore implantation. And ultimately, if that aspect is poor, it will have a negative impact on the pregnancy experience and increased risks of growth restriction and preterm birth. And everything that goes with that. So equally, I treat that aspect of a woman as well. And that's where the treatment starts, is optimizing the weight. So I know that this is an emotional topic. I know that this is something that is a journey. This whole thing is a journey. But if we really sit back and talk about what it is that we are trying to achieve, is we are trying to achieve a term healthy pregnancy, a live baby at the end of the day who's strong and healthy, who is going to be given the best chance at a fantastic life. And that starts with looking right back at the beginning and optimizing that environment. So to those of you who have asked the question or have wanted to ask the question, do I manage overweight or obese patients? Do I manage underweight or obese patients? 100% I do. But that's where we start, is with that process. The journey is with us together, and those are the healthcare professionals who we lean into. So I hope that helps answer a few questions. It's always a really heavy topic, but come back to me with any other questions you have, and I look forward to seeing you next week. I think we're about up to a live rapid fire Q&A again, don't you think? Have a great night.